Hello, we get a lot of queries asking us about treatment for dark spots. So first we need to find out the cause for the dark spot before we go ahead with the treatment. So my standard answer to every question which relates to treatment of dark spots is always that we need to find the cause first before we are able to treat it. Today I'll be telling you how you can treat the dark spots left behind after acne. I make videos on skin related concerns and on hair transplantation. If such content is of interest to you, then please subscribe to the channel. I'm very sorry for the background noise. I'll try to be as loud and clear as possible. There's heavy rainfall here in Surat, so it might disturb the audio a little bit. So why do dark spots occur after acne? Whenever there is any kind of inflammation in the skin, our skin will react by making pigment. Especially darker skin types like our Indian skin type, we tend to react whenever there is any kind of inflammation or a reaction by producing more pigment and more melanin. So whenever there is like an injury and the skin heals, the whole process of healing also leads to more pigment formation, because the melanocytes, the cells which make pigment, become hyperactive, and also the melanin gets redistributed in such a way that the skin tends to appear darker because of melanin deposition. This process of darkening of the skin after any kind of inflammation is known as post-inflammatory hyperpigmentation. This can be of two types, either epidermal or dermal. Epidermal means that the pigment is lying in the upper layer of the skin, which is the epidermis, and dermal pigmentation means that the pigmentation is lying, the melanin is lying just in the deeper layer, that is in the dermal area. So the pigment which is lying on the top, which is the epidermal pigmentation, tends to fade away quicker, while the dermal pigmentation tends to last longer. So what are the causes for this post-inflammatory hyperpigmentation that occurs after acne, and what are certain factors which predispose you to develop this pigmentation? First and foremost is if you have very severe acne. Larger lesions of acne tend to leave behind pigmentation at a much higher rate than smaller lesions. Also, if you touch your acne, scratch it, try to pop it, or you are sitting out in the sun excessively, all these will exacerbate the pigmentation that is being formed and leave behind dark spots on your skin. I have made an entire video on why you should absolutely not pop your acne and all the consequences that occur after popping your acne, which I'll be linking in the iCard. If your skin is very irritated, on the sensitive side, and you have a darker skin tone, even these can lead to post-inflammatory hyperpigmentation. So how can we prevent the formation of these dark spots? First, whenever you have acne, please do not try to touch it, scratch it, pop it or squeeze it, try to express the pus out. This will only make matters worse. So you must really control yourself and not do these maneuvers and let the acne heal on its own. Second is applying a sunscreen regularly even when you have active acne. I know people with oily skin and acne prone skin are very scared of applying sunscreen because they feel that it will exacerbate their acne or make their face look oily. But I have made an entire video on how to choose the perfect sunscreen if you have oily skin, so you can check that out. If you suffer from severe acne, seek help of a dermatologist. Start treatment early before worsening of the lesions. You do not have to pay very frequent visits. You have to first understand your skin type, understand what will be the best treatment for you, and then the maintenance regimen will not take too much of your time. So let's say in the first few visits you might have to go maybe every 2 weeks or every 3 weeks, but after 2 to 3 visits you'll have to go to the dermatologist maybe only once every 3 to 6 months. So that's not very bad, right? It's better to always seek an expert opinion and treat early to prevent all the after effects such as pigmentation. So how do we treat this post-inflammatory hyperpigmentation due to acne? So if it is very light and only a few spots, we just leave it alone. It will fade over time. How long it takes for these spots to fade depends upon your tendency to pigment and how dark the pigment is. If it is light, it will fade earlier, but if it is dark, then it takes longer. So we can use certain creams and take certain treatments to hasten this entire process. There are certain creams containing hydroquinone which should strictly be used only after receiving a prescription from a dermatologist and under supervision. This hydroquinone, usually in a concentration of 2 to 4%, can be applied on the dark spots. This will help in fading the dark spots. This cream is applied at night and washed off in the morning. But remember that if you use hydroquinone for a long period of time, then it can lead to ochronosis, which can actually cause more pigmentation than at baseline. So if you use it unsupervised, then it can lead to darkening of the spots, which is something you do not want. So I recommend that hydroquinone, any cream containing hydroquinone, must be used only under a dermatologist's supervision. Then there are certain creams which contain tretinoin. So what does tretinoin do? It helps with your active acne as well as your pigmentation. So tretinoin basically increases the cell turnover so that the newer, fresher skin that forms is lightly colored. So this can be used on the spots at night. Remember that tretinoin can cause irritation, so we always recommend the patients to start with a small quantity with a short contact period, maybe about half an hour to start with, and then they can wash it off, then slowly can build it up to 45 minutes to an hour, and once they're able to tolerate, they can leave it overnight. Remember that tretinoin is contraindicated if you're planning to have a child or you're already pregnant. There is a component called azelaic acid which, like tretinoin, helps with active lesions of acne as well as with the post-inflammatory hyperpigmentation. So azelaic acid is also a good cream to apply. You can apply it on the dark spots, similar way at night in a small quantity. This is better tolerated, causes less irritation as compared to tretinoin. This azelaic acid inhibits the enzyme which is utilized in the formation of melanin. So hence the use of azelaic acid will reduce melanin formation. So this can be used for a period of about 3 to 4 weeks till the spots fade away. There are other components such as arbutin, kojic acid, niacinamide, vitamin E, vitamin C. All of these do help in lightening the spots. Creams containing these agents can be used on the entire face twice a day, and follow this up with a good sunscreen with an SPF of at least 30, and make sure that you reapply the sunscreen. So along with the skin lightening agents, it is very important that you use a sunscreen, so that you can get results faster. If you don't want to wait for 2 to 3 weeks, and if you have like an event to attend or a wedding, then what you can do is go for certain peels containing retinol or lactic acid will help in very gently shedding the upper layer of the skin in order to expose a more rejuvenated skin. This can help with the post-inflammatory hyperpigmentation. So you can do peels at a duration of about 2 to 3 weeks depending upon how you respond. Maybe with 2 or 3 sessions you will notice a very good improvement. Q-switched Nd:YAG laser has also been used for this purpose. So you might require about 2 to 3 sessions of Q-switched Nd:YAG laser. So this can be done twice in a month on the pigmented spots. It will help in lightening the spots much faster. But the number of sessions that you require and the duration between the sessions will depend upon how pigmented your skin is and how you respond to the session of laser. So there you go. Now I have told you all the things that you can do to get rid of the pigmentation that remains after acne. So must remember that there is no one cream that can suit all. You have to look at how you're responding, what your baseline color is, what is the cause for the dark spot. Only then can we improve it. But few things to remember is that along with the skin lightening creams, sunscreen is very important. Try to cover your face whenever you go out in harsh sun, whenever you're having an acne eruption. Make sure that you're seeking help of a dermatologist at an earlier stage so that there's faster resolution of lesions. If you like this video, please press the thumbs up button and also subscribe to our channel. If there's any topic that you want me to make a video on, you can mention it in the comment section below. Thank you for watching. If such skin and hair related content is of interest to you, then you can follow us on other social media handles.